remarks of the chairman of the Presidential Task Force, the technical updates from the Minister of Health, the DG NCDC, and the National Coordinator. Before we go to the question session, we'll take updates from the Honorable Minister of State Education and the DG NCAA, who is standing in for the Minister of Aviation. So we begin this afternoon with the Chairman of the Presidential Task Force, the Secretary to Government. Sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me start by apologizing yet again. Our meeting quite straight as we are notching home to the end of the phase of the ease of the lockdown. We had to consider so many things. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 25th of June, 2020. You will all recall that on Monday, 1st June, 2020, we commenced the second phase of the eased lockdown in our national response to the battle against COVID-19 for a period of 4 weeks. As we informed you on Monday, we have entered the closing week of the second phase and approaching a decision point. We shall be carefully considering the fact of a growing pandemic and the risk perception in our efforts to balance between lives and livelihood. This pandemic is definitely not over, and we must remain careful and vigilant. All through the month, the Presidential Task Force communicated to Nigerians in different ways the dangers of complacency and non-compliance with measures prescribed for the fight against COVID-19. Particularly, Nigerians were reminded that there is presently no known vaccine for the virus, and that all over the world, non-pharmaceutical measures still remained the most effective, and avoiding being infected remains the best choice for everyone. The Presidential Task Force also continued to assess the developments nationwide and found that non-compliance has been largely fueled by skepticism and ignorance about the disease. We also noted that stigmatization has further impacted on the willingness of people to come out to seek help and even tell their stories. In most cases, by the time they take a decision to come out, it is rather late. The nature of this pandemic demands that we must detect and treat it in order to address it. Let me emphasize, therefore, that COVID-19 is not a condition to be ashamed of, as it has no respect for status, nationality, race, creed, tribe, or color. Every person infected must be treated to prevent spread and avoid fatalities. As we deepen the community engagement and risk communication phase of our national response, the Presidential Task Force still reiterates the need for ownership, taking responsibility, and expanding the scope of sensitization, all of which combine to make our ability to maximally detect, trace, isolate, and treat nationwide successful. You would have noticed that the number of confirmed cases and fatalities released in the last few days have been on the high side. While we attribute this to increased testing, it also goes to confirm the extent of the spread within our communities, especially the 21 local governments that are considered high burden, identified as accounting for over 60% of infections nationwide. Closely related to the high number of confirmed cases and fatalities at home are lessons drawn from other jurisdictions, from Europe to China to the United States of America. The rising numbers and reported resurgence in some cases should also be of concern to us. Of particular concern, however, is the case of Brazil, which has exceeded the 1 million mark of confirmed cases, with over 50,000 fatalities. We have informed you that Brazil shares several cultural, demographic, and climatic affinities with us. If any lesson is to be learned, Brazil should be a subject of interest that will make us change our behavior. In furtherance of the collaboration with subnational entities, the Presidential Task Force joined the Nigerian Governors Forum and the NEC in a virtual meeting yesterday to evaluate the progress made so far. The outcomes of the discussions will be factored into the decision under the next steps. Ladies and gentlemen, the Presidential Task Force notes and acknowledges progress being made globally and domestically to search for cure for COVID-19. It also notes with delight the recent announcement that 4,000 people have volunteered for a vaccine trial in the United Kingdom, which gives room for greater hope. We similarly look forward to the outcomes of validation processes for submissions made by some Nigerian CITES. Given the findings made during our assessment, I feel compelled to reiterate the non-pharmaceutical measures put in place by the Presidential Task Force so that you will have the opportunity to internalize all these measures. The first being wearing of face masks in public places, keeping social distancing, maintaining good respiratory hygiene, washing of hands regularly, avoiding large gatherings, generally changing our behavior and actions. And finally, taking personal responsibility for our lives and those of our loved ones. Please remember, all the measures listed and many more are meant to be observed in a combined manner in order to make them effective in saving lives. These are our fighting opportunities for survival. The Presidential Task Force has continued to receive reports about hospitals rejecting patients, thus resulting in needless death of patients suffering from other ailments. We continue to plead with these hospitals not to reject patients, but to follow the protocols for managing COVID-19 while receiving them, and most importantly, to seek necessary accreditation from the Ministry of Health and the Nigerian Center for Disease Control to manage COVID-19 cases. Finally, I wish to inform you that by the end of this week, the Presidential Task Force will be submitting a report containing our assessment and recommendations to Mr. President for his consideration. We therefore urge Nigerians to await our recommendations regarding the next steps of action to be taken in our national response to COVID-19. I now have the honor to invite to the podium the Honorable Minister of State Health, followed by the DG Nigeria Center for Disease Control and the National Coordinator to update you on new developments. And I thank you for listening.
Thank you very much, the Chairman of PTF, my colleagues in the committee, media representatives here present, distinguished ladies and gentlemen. The number of deaths related to COVID-19 cases in Nigeria has continued to rise. The import of this is that as individuals, we are more than ever before continually reminded to take personal responsibility for our health and be extra careful in our daily activities. As of yesterday, we had 649 new confirmed cases, bringing the total number of cases in the country to 22,020. We have so far successfully treated and discharged 7,613 persons, while sadly we have recorded 542 deaths. On Tuesday, 23rd June 2020, an emergency National Council on Health was held virtually. In attendance were State Commissioners of Health, Secretary of Health in the FCT, heads of agencies under the ministry, directors, and the Federal Ministry of Health, development partners, and other stakeholders in the health sector. Council reviewed the status and alignment of all response activities of COVID-19 outbreak in the states. The Council approved the National Health Sector COVID-19 Pandemic Response Action Plan, which was developed by the Federal Ministry of Health in collaboration with departments and agencies to present one response in the health sector delivered in a coordinated and strategic manner. As we learn more about the disease, we continue to evolve response actions. The community transmission has resulted in a high number of confirmed cases, with the challenge that in some states, the facilities for case management may become overwhelmed. Bearing in mind the importance of managing cases in facilities, the Federal Ministry of Health, through the National Primary Health Care Development Agency, has developed a guideline for the establishment of community support centers where desirable. A central objective of this guideline is the establishment of community support centers in selected clusters of local government areas for the management of COVID-19 cases. These community support centers will strengthen the capacity of the health system at the community level to respond to the outbreak with a view to reducing the transmission of COVID-19 within communities in high burden and high-density states. We must daily be reminded of the challenges COVID-19 poses to Nigeria and the world. Hence, the need to reinforce our resolve to tackle the pandemic. We shall continue to strive to reduce case fatality in Nigeria. In this regard, we will seek cooperation from all to scale up our non-pharmaceutical interventions while we get more proactive in dealing with positive cases. We shall improve on our testing, tracing, treatment, and isolation, with priority on offering more protection to our elderly citizens and those with comorbidities from the threat of infection. I thank you for your kind attention.
Secretary to the Government of the Federation and Chair of the Presidential Task Force, Honorable Ministers, gentlemen of the press. I'll be fairly brief today, really respond to a few issues that have been on the hot burner, three particular issues. Firstly, we do look out on what people are discussing on the media through different platforms. And over the past few weeks, there have been a lot of discussions over the role of a loss of smell and taste as symptoms of COVID-19. These have been recognized globally as symptoms of this disease. There are very few other diseases that would cause a sudden loss of taste or smell, especially in normally otherwise healthy individuals. So it's most likely that this is linked with an increasing incidence of COVID-19. So we would expect that this should also lead to increased presentation at clinical facilities and increased testing. So this is just to make it clear to Nigerians that if you do feel that you're losing your sense of smell or taste and taste, this has been recognized as a symptom of COVID-19. You should be presenting yourself and for testing. We will, all over the country, there are people there available to test you through the state's public health infrastructure in order to rule in or out whether you have COVID-19. Secondly, there's been an increasing use of face shields to apparently protect you or the population from the transmission of COVID-19. And today, I'd also like to advise that face shields are great, but they should be used in addition to face masks and not in place of. I know we haven't been clear on this, so we are doing that now. So we will forgive anyone that is wearing it today on both sides of the aisle. But please, we are learning, and that's what I've always said on this particular disease. So we're learning every day, new technology is emerging, and the lack of evidence of effectiveness actually doesn't mean that we will not ultimately find evidence of effectiveness. But from what we know at the moment, it is not sufficient. It's not sufficient to protect ourselves and the population. So we can gradually, over the next few days, evolve out of face shields and back to masks. And so the third point I just want to touch on too are vulnerable populations. Many of us are either at the borderline of that classification of being 50 and above, and many of us have underlying medical conditions. So when you talk about comorbidities, it sounds like something very rare. Many of us are hypertensive. It's much more common in Africans than in others. Many of us are diabetic. We live with it every day. So these are not strange illnesses. And I just want to remind all of us. Many members of our family have these diseases, so we have to be really, as we think about the risks that we take, it's not just about us. It's about those of our friends, our relatives that may have any of these, when we call them comorbidities, it sounds like a strange, impossible thing. But really, these are really common diseases that many of us, if you do a random sample of this room, you find that 10-20% will be hypertensive, 2 to 5% will be diabetic. This is just a fact of prevalence and distribution of diseases. So these are not rare diseases. So as we take these risks and try to be motivated to do the right thing, let's think about others that may be more vulnerable than ourselves to these circumstances. So it's important to think about age and people that have hypertension, diabetes, cancer, as really vulnerable to having a much more severe illness than the rest of us. So just on those three thoughts today, very simple thoughts, if we can reflect on them over the weekend, use them to change behavior as much as possible, and try and keep safe as we go into a very important weekend in making key decisions about the future. Thank you very much.
The chairman of the PTF, honorable ministers, members of the PTF, gentlemen of the press, good evening. Today I'll be talking about disbelief. I will be tackling headlong the issue of why people feel that COVID-19 does not exist. We are aware that many Nigerians do not believe that COVID-19 is real. Many think that it is a scam or a ploy to access funds meant for public welfare. Some do not believe it's real simply because they have not seen or do not know someone who has tested positive for COVID-19. But tell me, how many of you have seen a case of Ebola? How many of you have seen even a case of Lassa, or even some of the more sort of common infections? You do not need to come across a patient with a life-threatening transmissible infection before you believe in it. There are people who do not believe it's real because they are not seeing the sort of high number of deaths or the health crisis that is currently occurring in many parts of the world. But our numbers are already increasing. We don't want to reach that stage. But if we don't want to reach that stage, we have to take those measures that are necessary to protect ourselves and our loved ones. A reasonable number of people still believe it's a disease that affects other countries but not Nigeria. Well, I'm afraid we are all humans in Nigeria. There's nothing special about us that provides us with resistance against COVID-19. None. As the chair said, our climate is very similar to that of Brazil. The health system is much, much more sophisticated than that of Nigeria, but you can see the sort of problems they are currently facing. We must start believing in COVID if we are to protect ourselves from this infection. The truth everyone must know is that COVID-19 is real. People are dying from COVID-19. We have had personal experiences of that. There are people that are currently not with us at the moment because of COVID-19. Many countries in the world are fighting this pandemic. Over 9 million people have tested positive, not suspicion, but tested positive for the disease. And at least 22,000 of them are in Nigeria. There are thousands more in our country. For every one case, there are a handful of cases that we are missing because we are not able to test everybody. Governments across the world and even in Nigeria have shut down their economies and lost valuable resources in an effort to control the spread of COVID-19. The containment measures that were put in place to protect the public are there to protect the public. They are not there to swindle them. No sane country on earth will destroy its own economy willingly. No sane country on earth will take major decisions that they know would be detrimental to their economy. Even among the strong economies, some of them have had significant drops in their GDP as a result of containment strategies. They would not take those steps lightly. No. And certainly in our generation, for our generation, this is the most important public health emergency of its kind. When was the last time people have been locked in their houses for 5 weeks? For 5 weeks. When was the last time we closed the civil service completely? We stopped flights from coming in. We haven't had international flights that are scheduled for a long time. So we're living in really challenging times. And we couldn't have taken these decisions just on the basis of maybe suspicion that a disease exists. This disease does exist, whether we like it or not. It exists. If we want to survive it, we have to start believing in it. The profile of infected people has shown us that COVID-19 knows no class, it knows no race or gender, and it can certainly affect anyone who is exposed to it. We do not need to know someone personally who has died from COVID-19 to believe it is real. In fact, I think it is a disservice and it is insensitive to those families that have lost loved ones for people to continue to claim that COVID-19 does not exist. The PTF is appealing to Nigerians to assist the government and all our partners at all levels to fight against this virus by taking ownership of this fight. And this is by following strictly all the health advisories we have provided, including always wearing a face mask properly, not on your chin, not to cover your beard, but to cover your face and your nose. Maintain physical distancing at all times. Avoid mass gatherings. Wash hands frequently with soap and water. Use hand sanitizer and disinfect surfaces. We may be relaxing some of the measures we put earlier on, but the relaxation does not mean that we are at a lower risk of catching this. As I keep on saying, now, today, you are at much, much higher risk of catching COVID if you go into a public space than you would ever have been in this country because of the numbers we have. And if you do not need to go out, stay at home. That is still the best advice we can give you. Let us not wait for the virus to reach disastrous proportions before we begin to believe and act. We are already seeing this happen in many other countries. We must learn from their experiences to mitigate preventable fatalities. We know that humankind has survived previous pandemics. We know that this challenge will pass. We also know that for us to be able to face this, we must not despair. We must face this challenge headlong together and survive it. Thank you.
To the podium.
Good evening, everybody. I'm actually constrained to make this clarification because some of our brothers in the press did publish something yesterday to the effect that we are no longer sure, and that somebody claimed that I had told him or them at a Senate briefing that the coronavirus is a sham. Well, I must address you all and tell you that no such thing transpired. Coronavirus is real, and we've been meeting over this and working to strengthen our response to this pandemic. I recognize, as somebody who is in the Ministry of Education, that all our intelligent quotients are not at the same level. So maybe some people may have a different perception of what I said, or maybe I spoke in a lot of grammar that wasn't assimilated properly. So I must then excuse them. However, to be clear, I did point out that part of the reason why we are keeping our children at home stems from the fact that you can't see this coronavirus with your physical eyes. So you may not know if a child is asymptomatically carrying this. And if he or she so does, and then goes back home and infects another person, there's no way for us to guarantee. And besides, that the ministry had prior to now conducted a perception survey around the country. And we know that 80% of the responses we got from around the country were assurances from parents that they are not willing to experiment with any of their own children. If there are people who are interested in using their children to experiment to check whether it can work or not, we can invite them to test. But I can assure you that all the measures that we've taken are guided by the gentlemen who are behind us here, whom the President have assembled to give a scientific background that is governed by data and science to the decisions we make. I am sure that some of the work we presented, having taken some advice from them, will be reported maybe next week, because now we have sufficient information to make some decisions. And those decisions will be, first of all, x-rayed by and presented by the PTF upwards. And when we're cleared with that, I can come back here maybe by Monday and say exactly what exactly we are planning. But until then, kindly abide by what has been told, said by this committee. People should stay at home, keep our children safe, for you and for me, because they are the future journalists. It doesn't matter what their question will be. Thank you.
I'll now invite the DG.
Ladies and gentlemen, good evening. Since last announcement, last week, Thursday briefing, that Sunday, 21st of June is no longer feasible for the opening of the airport, I would like to report that we've had significant progress in the readiness of the industry to restart. The gaps have been closed, but however, we still have a few gaps within the aviation ecosystem, and this will be closed hopefully in the next couple of days. I've said it, and I'll keep saying it, we must get it right the first time, both on the issues of technical safety and health safety of all stakeholders. And one of these things we're going to use to close some of the gaps is a dry run test of both Lagos and Abuja airports coming up this Saturday. After this dry runs, we'll have a look, observe, and see the gaps that might still be there, and we'll close them. After that, we will announce a date of restart shortly, sometime next week. Aviation is already a very complex system on its own, and by the time you throw in the COVID-19 pandemic, it already complicates a very, very complex system. We will not take any chance. We are almost there. When we close all the few remaining gaps in the aviation ecosystem, we'll start. Thank you very much.
Thank you for the clarification. We now switch over to the question session. Are we ready to present our questions? Okay, let's do it.
Good evening, the chairman and members of the Presidential Task Force and Nigerians watching at home and in the offices. Just a quick question for the Minister of State for Health. My name is Mitaire Ikben. I report for the Nigerian Television Authority. A critical aspect of the fight against the coronavirus pandemic is the search for solutions, whether homegrown or foreign. And we have already been told by the task force that with respect to a vaccine, it might not come to fruition until maybe 2021, as the case may be. So a lot of Nigerians are interested in what happens before then. Is it possible that we can have a homegrown solution before 2021? Because the Presidential Task Force has told us that three local claims have been shortlisted for validation. That's, I believe, in addition to the Madagascar solution. So my question is, what is the timeline for this validation, and what is the process like and the timeline? Because Nigerians are interested, they are watching closely, and they are following, and they want to know. Thank you.
Good evening, all. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to just follow up with the question from my colleague, Mitaire. And I'm directing to the Minister of State for Health. It has to do with the supplement we received from Madagascar. The ministry told us that some agencies have collected the samples for further studies. How long will it take for us to get their findings, whether this supplement is useful or not? I just wanted to start from that because he asked a question about the timeline. Now, I would like to ask the DG NCDC regarding the records that we had in the last few weeks. I noticed that some states like Zamfara and Taraba, if we compare the number of confirmed cases from those states with what we had like 3 weeks ago, the cases are dropping. Is this any indication? Is it an indication that those states are winning the fight against COVID-19, or testing is simply going down in those states? What's exactly happening in those states? And I also like the Minister of Foreign Affairs to respond to this. Okay, it's not here. Oh, all right. I actually wanted him to respond to the criteria for enlisting people for evacuation, but it's not here. Maybe we'll keep it for another time. The Minister of Information, I would like you to respond to this. What's the update on the ventilators that was promised by the US President? You told us some time ago that the US President has promised to give Nigeria some ventilators. What is the update? Are we still expecting them? Are they giving them? Thank you.
Good evening, all. I'm Rachel Abuja from the News Agency of Nigeria. And my first question is to the Ministry of Health and, of course, the SJF. So when this whole pandemic came on board, Nigerians were not prepared. And the Basic Healthcare Provision Fund was giving us an opportunity to prepare for the next pandemic. I don't know why taking off the health emergency funding will not only do us wrong at this point in time, it will also put the country in a very difficult position. So I think it's something that the government should be looking at, and we should know what the government is proposing for health emergency. My next question is now for the Ministry of Health. Yesterday, Governor Darius Ishaku of Taraba State was pleading for testing centers. I would like to know who is responsible for setting up a testing center in the country. Now, my next question is to the DG NCDC. DG, I would like to know how much collaboration you have with the National Assembly to ensure that test centers are in every or in each constituency at the moment. Meanwhile, how supportive is NCDC to see the enlistment of more private laboratories in the country for testing? Then my next question is for the coordinator. So, actually, this question is for the primary healthcare ES, but since he's not around, I would like you to help us out here. Now, there's 1.2 billion naira proposed for renovation of 7 centers in the 20 hotspots and areas of COVID-19. I would like to know where this money is coming from, if it's a grant, donation, or from federal government or state government, and we want to know the kind of renovation that we should be looking at. Many thanks.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orum from AIT. I would like to start with the Minister of Health. On Monday, I asked the Minister of Health when he was here the cost of treatment for COVID-19 patients. Well, he said it rests on state and FCT level. Well, I believe as the #1 man in the Ministry of Health, you should have an idea of what it costs to treat a COVID-19 patient that have spent at least 14 days in isolation center. So Nigerians will want to find out if you can attach a figure of how much it will cost to treat a COVID-19 patient. My second question is to the Minister of Education. Well, on Tuesday, you were at the National Assembly to present guidelines for possible reopening of schools across the country. Now, I'm aware that ASU has been on strike since the 28th of March due to IPPRS issues that have not been settled. Now, senior staff, SANU, and also non-academic staff union have also said any day the federal government will out a date for possible reopening, that is when they are going to embark on 2 weeks strike. So I want to know exactly what your ministry is doing to ensure that upon resumption for our students to go back to school, they are not told to wait back and wait until issues of IPPRS have been resolved. My other question to you, sir, is that during your briefing at the National Assembly, you mentioned that one of the requirements for reopening of schools for some schools is they must set up an isolation center and also a clinic. For some schools that are in the rural areas, I want to know how they'll be able to get money to have an isolation center or a clinic, or is the ministry planning to give them some sort of grant or loan to set up these isolation centers? Thank you.
Good evening, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My first question is to the chairman, sir. Listening to you today and on Monday reeling out statistics, one can understand the strong warning that the worst is not over yet. And but my questions, I want to know, sir, in the course of making decision in easing out the lockdown, even though clearly you stated that easing out the lockdown does not mean downplaying the severity of this pandemic. So did you envisage the kind of situation we are today? The numbers are going up. Now, Dr. Sani Aliyu said, in each case that we have in Nigeria, there are so many cases that are missing. So who knows how many people now are impacted with the disease? My next question is to the Minister of Health or NCDC DG. Sir, a recent study shows there is increase in vulnerability in the type of people that are infected with this disease. It shows even people under 40 are now vulnerable in catching